I thought it'd be valuable information and give you insight into what my thought process is during my OT evaluations. When my hope is that you're going to see things that are really important to take note of so you can make those changes in your life. The first question I always ask is, are you a good water drinker? This is important because if your blood pressure is already low from dehydration, when you go to stand up, it's going to drop further and you're going to be at risk of falls. Dehydration will also make you feel tired and sleepy, and this can lead to tripping over your own feet. I'm also interested in your water intake because I want to know if you're at risk of a urinary tract infection. When we don't drink enough water, bacteria in the bladder get a chance to multiply, and this can cause an infection that can lead to mental confusion. This altered mental status is a frequent cause of falls with injuries. Rushing to the bathroom is another common theme for falls. Many of my patients are on Lasix to manage swelling in the ankles, and this can mean that they have to go to the bathroom a lot because they have to get rid of that excess fluid. But unfortunately, patients try to cope with this by limiting the intake of water, and they try to decrease the number of times they have to go to the bathroom. But what happens instead is that the urine gets more concentrated, and this will irritate the bladder, and it produces a sensation of urgency. A large majority of falls occur when patients are trying to get to the bathroom on time to avoid having another accident. A better option would be to drink small amounts of fluid frequently and make sure you get up and move every 30 minutes. Falls are also prevalent when patients get up suddenly after sitting for long periods of time. Maybe they went to go answer the phone or the door. When we sit too long in one position, it's hard to get up because of stiffness. Our leg and core muscles, they all turn themselves off after not being used for a long period of time. So when you suddenly need to get up and move quickly, they're not ready for this and they let us down. My legs just gave out on me is what I hear a lot. The other thing I want to know is, how often are you getting up to pee at night? This may seem personal to some, but it's important. If you're getting up more than 2 times a night, I want to know, because if you're getting up that much, you can't be good at getting good quality sleep. And when you don't sleep well at night, you're not as alert during the day, and that can lead to falls. So if the answer is more than 3 times a night, I want to know, are you stopping fluids by a certain time? Are you making sure to put your feet up above your heart 2 hours before you go to bed? You have to drain all that swelling and fluid back from your ankles into your bladder before bedtime, not after. The less you get up at night, the lower your risk of falls. Statistics show that falls occur most often in the bedroom or bathroom, and I find it's really going to the bathroom in the middle of the night. Sometimes patients get tangled up in the bed sheets. Sometimes they trip on dog toys or shoes that got left out. Sometimes the problem is that patients are using really, really dim night lights because they don't want to turn on the lights and wake up their spouses. The problem is, as we age, so does our vision. Our depth perception is not as good and our night vision is less sharp. We need more light to compensate for this. And by the way, I'm quite sure that if your spouse had to call 911, they would definitely be awake. So those secrets of aging well are all free: water, sleep, exercise. If you stay hydrated, your blood pressure is normal, you have energy to move. When you move, you decrease your risk of pneumonia, you increase your quality of sleep, and you wake up feeling rested, happy, energetic, and alert. And when you feel happy and energetic, you're motivated to exercise, eat well, live well. Did you know that depression is associated with a 47% increase in falls? The frequency of falls in the home has gone up hugely since COVID. And that was because people stopped being able to go to the gym to exercise. And that decrease in social interactions, the poor sleep from all the stress, it's proof of how we live our lives really impacts our safety in the home. Healthy habits and routines help us be our best selves by keeping our bodies on a schedule. Our bodies feel physical stress when they're not routinely fed and rested. It's important to make sure we get enough good quality sleep, keep our blood sugar stable, stay hydrated to keep our blood pressures from falling when you stand up. So how can we improve this? The first thing is to make sure that we change our environments to fit our current needs. The second one was to make sure that you stay physically fit so you can have freedom. And the last one we just talked about was the need to take a good look at the lifestyle choices we make and just recognize the role it plays in determining how well you're going to function at home. Falls happen, and that's okay. We just need to use it as an event to signal, take a closer look at our environment, check out how we're living our lives. Is that in line with our goals? In the meantime, I'm going to teach you some basic biomechanics you need to remember so that you can get yourself up off the floor. And remember, if you remember nothing else, just remember that your goal is to get up onto your hands and knees so you can crawl to a surface to get up. If you can do that, you can stop having firefighters come and pick you up off the floor at 3 a.m. And instead, you'll be sleeping like a baby.